Well, hello everyone, and welcome to the Hypertension Priority Setting Partnership information session. I'm Felicia Flowett, and today's session will go over the goals of the Priority Setting Partnership, and we're really happy that you guys were able to join us. We will need all of you to be involved in a successful partnership. As the project manager, I will also be your MC for today. Our goal for this session is to explain the process of setting priorities in hypertension and how you can be involved as a participant or a partner. We are grateful to those who have partnered with us so far, including the Institute of Circulatory and Respiratory Health at CIHR, the University of British Columbia, the James Lind Alliance, the Canadian Council of Cardiovascular Nurses, and the Ontario Stroke Network. We hope that you will find this novel approach to patient-centered research as exciting as we do. As we go through the presentation, please feel free to submit your questions into the appropriate box below the video. If you have any trouble with the box, please send your questions to info@hypertension.ca. Today's session will aim to answer 3 key questions. First, what is the purpose of the project? What process will the project follow? And what outcomes or payoff do we expect? And how can you be a part of it? Dr. Nadia Khan, Vice President of Hypertension Canada and the project's principal researcher, will explain the purpose of the project. Her unique perspective is informed by her roles as a professor of medicine at the University of British Columbia, a scientist at the Centre for Health Evaluation and Outcomes Sciences, and her clinical experiences as a general internist at St. Paul's Hospital in Vancouver. Sheila Upadhyaya is a consultant with the James Lind Alliance, based out of the National Institutes of Health Research in London, England. She has helped us to understand the priority setting process, and there is no one more qualified to help us explain it to all of you. Angelique Berg, CEO of Hypertension Canada, will help to frame this project in terms of its payoff and how we expect to change the way hypertension research is done in Canada. For those who do not know Ms. Berg, she has more than 20 years' experience in the healthcare sector and has seen firsthand how patient-centered research can change the way we approach health outcomes. I will now ask Dr. Nadia Khan to kick off the info session by introducing Hypertension Canada and describing the purpose of the project.
Thank you very much, Felicia. So everyone, welcome to our information session again. And really, Hypertension Canada includes many of Canada's leading researchers and healthcare professionals in the field of hypertension. Next slide. And Hypertension Canada, you may recall, it's really the only national nonprofit organization that's sole purpose is to improve the prevention and control of hypertension and hypertension-related complications in Canada. And we really do have many of Canada's leading clinical and scientific experts, and we're best known for publishing hypertension guidelines for the primary care physicians and healthcare workers to best diagnose and control hypertension and as well to prevent hypertension. And we really educate physicians and other healthcare professionals as well as give information to the public about how best to diagnose and manage hypertension. Next slide. And in the past, really, the traditional method of scientific inquiry is that most of the research ideas really come from the scientific community, researchers, and healthcare professionals as well. And we've really recognized over the last several years that patients and their caregivers, and also many of the healthcare workers that see patients on a day-to-day basis for different conditions, have a different, a unique, and really important perspective on what are really the important questions that need to be answered. And we know from other studies that these questions actually differ from the questions that the scientific community comes up with. And Hypertension Canada, its ultimate goal is to improve blood pressure and well-being of people with hypertension. So we thought it would be really the best idea to try to figure out what are the questions that patients, their caregivers, and the frontline workers that see patients, pharmacists, dietitians, kinesiologists, nurses, primary care doctors, what are their questions? What matters to them most about the management of hypertension, and really what are their unanswered questions? So that's really the purpose of our work, is to really try to elicit those questions that they have, and then we'll be better able to try to work towards answering them. Next slide. So we've set about doing a research study, and the research study was funded by Hypertension Canada and CIHR, that will try to get at these questions through a national survey. And then we're working with, in our steering committee, we're working with patients, with people that live with hypertension, their caregivers, and as well a lot of healthcare professionals across a wide variety of subjects across the country to try to help look at these questions and come up with a really succinct set of key and important questions that Canadians want answered. Next slide.
Thanks, Nadia. So I'm going to tell you a little bit about the process and how the process will work. I'm Sheila, and I'm working at the James Lind Alliance in London, as Felicia talked about earlier. Felicia, next slide, please. So what is the James Lind Alliance? It's an organisation that is really keen on trying to tackle treatment uncertainties together. So we've talked about trying to identify questions that you have unanswered about your treatment for hypertension, and this process will help us to identify where there are uncertainties or questions that haven't been answered. And the idea is for us to ensure that patients and service users, caregivers and relatives, and clinicians and healthcare professionals are on an equal footing and are able to identify what those questions are as equal partners within the process. Next slide, please. So what is it that the James Lind Alliance does? It sets up these research studies like the Hypertension Priority Setting Partnership, because we're really mindful of the fact that, as Nadia said earlier, that prior to this process being deployed, a lot of the research was set by pharmaceutical companies or research organisations or clinicians who had an interest. The idea around this process is that we involve patients, caregivers and clinicians. We try and focus on single conditions, so in this case it's hypertension, and try and identify those questions about those treatments so we can inform further and future research. And at the end of the process, we'll come up with the top 10 research questions that hypertension research should focus on in the future. Next slide, please. So how are we going to do this? We're going to set up a steering group. So Hypertension Canada have been actively working with their partners and the clinicians, and they've set up a steering group that is going to manage and steer the process. They then invite partners. So you've seen some of the partners that Hypertension Canada are already working with, and they invite them to participate in the process so that they can be used to disseminate the questions that we're wanting answers to, and to gather those questions together so that we can start looking at what sorts of research should be undertaken in hypertension. Then the process looks at prioritising those questions that have been submitted. So once those questions have been gathered from the caregivers, from clinicians and other people involved in the care of patients with hypertension, those questions will be prioritised. And at the end of the process, Hypertension Canada and their partners will look to promote those priorities to researchers and funders so that they can get further resources into the hypertension research agenda. Next slide, please. So just for clarification, what are treatment uncertainties? And I will try and put this in as much basic language as possible, lay language as possible. So it really is a process where no up-to-date, reliable, systematic reviews of research evidence addressing uncertainties about the effects of treatments exist. So in trying to put this into a bit of a lay language, Lots of research is undertaken in lots of treatments, and lots of studies report lots of different outcomes and lots of different effects of treatment and so on and so forth. A systematic review is a process by which all of those studies, looking at all the different questions, put together all the evidence that's been researched and try to see, has this question actually been answered by research? Have all of those combined studies answered a question that might exist? And the idea is to see whether all these studies actually have answered the questions, or actually are the questions that have been submitted still unanswered. So the idea is that we can make sure that this research hasn't already been undertaken, and we don't then end up putting resources into areas where we've already put money into. Next slide, please. So what are the steps? What we do once we've undertaken the survey, and some of you may have already seen Hypertension Canada have sent the survey out, they will select and collect all of the uncertainties that are submitted by the stakeholders, so that's the caregivers, the patients, and the clinicians involved in the care of patients, and they will summarise that list into a short list of questions. And then top 10 uncertainties will be chosen by the partners who are involved in the process as individuals, on behalf of members, on behalf of colleagues, and they're representing an organisation. So they'll be able to have that joint membership and that joint process so that everybody feels like they've made a contribution to the top 10 priorities. Thanks, Felicia. Next slide. The step two. The step two is the best part, I think, is the opportunity for all of these people, the patients, the caregivers and clinicians, to get together on a one-day workshop where the interim questions are shared with everybody and there's a discussion that goes on about what's important to people. And I think the beauty about the workshop is that clinicians, for example, get to hear firsthand how patients and caregivers experience looking after patients with the condition that's in question, in this case hypertension, and vice versa. Patients and caregivers get an opportunity to hear how challenging it is for clinicians and why they find it difficult to give the best advice or be able to give the best treatments. And that day will involve a lot of discussion and workshops where at the end of the process we'll agree a top 10. Next slide, please.
Thanks, Sheila. I'm Angelique Berg and very pleased to address you all today. Hypertension Canada is really excited about this project and setting the priorities for research through patient engagement. I personally have seen the power of this in another area, many years ago now, in orthopedics. And to give you a sense of what kind of impact patient input can have, I can give you an example of orthopedic hip replacements. So at one time I was at a meeting where we were engaging patients in talking about research and talking about what's important to them. And there was a group of orthopedic surgeons who felt that hip replacements were going really well and these were really successful surgeries. And the little man stood up and said, you know, I'm glad you are so enamored with your own work. However, I still can't tie my own shoes. And what arose from that was orthopedic researchers figured out how to allow the hip to bend more than a 45-degree angle so people could actually tie their shoes. Sometimes it's just really simple things like that. I'd like to tie my shoes, please, can change the way that medicine is practiced. So I've seen that in action, and I'm so excited about the potential of this project. Next slide, please. So what will we do with the top 10? This is really just the beginning for Hypertension Canada. When we actually have that final list and we've gone through the process that Nadia and then Sheila described, we need to share it then. We're going to share it to generate both funding for hypertension research and interest in hypertension research as a career. We're going to promote the priority list to funders of research in Canada, the Canadian Institutes of Health Research, those that you see listed on the screen, and other health charities as well who provide funding for hypertension research, and hopefully influence how they're going to adjudicate their application process and what they'll put at the top of the list when they receive applications about hypertension. We're also going to share the findings with our stakeholders and reach out to students and clinicians and senior investigators, other research institutions, to raise the profile of hypertension research and hopefully encourage the next generation of researchers into the field so that they can help solve those challenges that matter most to you, to partners, to patients, and to people who care for patients. Next slide. We need to hear from hundreds and possibly thousands of Canadians, and no matter who you are on this call, you can help. We need people to complete the survey themselves. The survey is available at hypertension.ca, and we need you to tell everybody you know about it, whether that's your neighbor or your friend or perhaps your network at your workplace, on your website, however you can, to spread the word about the survey and encourage people to engage in it. There's other ideas on this slide, sharing links, writing letters and emails to members in your networks to ask for how they're helping disseminating and completing the survey, and perhaps encouraging clinics either where you work or in your community to hang the posters and other information that we've provided in those places to let people know, and so they can be a part of it too. We've developed templates and tools so that you can help us and to make it easy for you to help. And we have a library also of tweets and of Facebook posts. If you're active on social media, we'd love you to add your voice to letting people know about this. It will be difficult. Even though we may say we only need 500 or 2,000 survey completes, it will be difficult to get there, and we'd love to have your engagement in helping us reach that goal. Next slide. If you have any additional questions or if you'd like to obtain the tools and templates, please contact Felicia. She's at the email address on your screen. And join in our social network so you can be kept up to date on the project. We're very excited about this, so we'll be talking about it a lot and keeping you informed about how you can join with us. With that, I'll open the floor to questions, and I believe Felicia will be our moderator for the question box and those that we receive.
Hello again, everyone. So if you would like to submit questions, you can do so either in the question box below the video or to info@hypertension.ca. So far, we have one question over email, which is this. So the question is, hypertension is a very big topic. Are you looking for all kinds of research questions about hypertension, or are there certain limits? Perhaps you can answer that one, Nadia?
Yes, so that's a great question. So what we're really looking for is all questions about hypertension management. So after someone's been diagnosed, so how do things go in regards to the treatment? So any treatment questions you have, and that's really what we're focusing on. So treatment, for example, can include your interaction with your healthcare worker, your medications, anything to do with any of the lifestyle modifications to controlling blood pressure. Those are just some examples, but really we're interested in the management of hypertension.
Thank you very much, Nadia. That was great. If anyone has any follow-up questions or any additional to add, we'll wait just a couple seconds before wrapping up officially. All right, well, thank you for that question. And if we didn't get to you, or if you have something that pops up after the info session is over, please feel free to follow up with me by email, and we will be sure to answer. For anyone who missed the session or would like to review it, the recording will be posted at this same page and also on the survey page at hypertension.ca. I will now ask Ms. Angelique Berg for some closing thoughts.
Thanks, Felicia. In closing, I would love to thank Dr. Nadia Khan for initiating this groundbreaking research project. We're so excited about it. And Felicia for managing it and bringing it to life, and especially to Sheila for her guidance from the James Lind Alliance. We're very excited about it. And thank you especially to all of you who are either listening live or watching later for being such a big part of this. It's your questions and it's your perspectives that will shape the future of research in Canada, and we're very excited about having your engagement in that. Hypertension Canada's mission is to advance health through the prevention and control of hypertension and its complications, and we're very excited about charting the future of research priorities in hypertension with you. Thanks so much for your engagement.